If you want to know what treatment is needed for someone on a ventilator in ICU with lung cancer cells, pleural effusion, and bile that continues to come out of his body, stay tuned. I've got news for you. My name is Patrick Hutzel from intensivecarehotline.com, and I have another quick tip for families in intensive care. So today I have an email from Tammy who says, "Hi, Patrick. My husband is 61 years of age. He's on a ventilator in ICU. He's got lung cancer cells. He's got pleural effusion, and he's got bile coming out of his body. What treatment would you suggest?" Now, Tammy, I'm very sorry that you're facing this, and I'll certainly provide you with some helpful information here. Based on your description, your husband's treatment will depend on the severity of his condition, his overall health, and the goals of his care. Here are some considerations for managing his situation. Number one, he's on ventilator support. If your husband is on a ventilator, it means his lungs are not functioning properly and well enough to sustain breathing on their own. Ventilator support will continue to provide oxygen and remove carbon dioxide. And the medical team and the nursing team will assess whether ventilator support is temporary or long-term and discuss options including tracheostomy potentially, or if, depending on the goals of care for your husband, what he wants and what you want, if palliative care is an option, or if weaning off the ventilator is possible or isn't possible. Next, because he's got lung cancer and the pleural effusion. Lung cancer can cause pleural effusion by fluid buildup in the chest cavity. If cancer cells are in the fluid, it is called malignant pleural effusion. Treatment focuses on relieving symptoms and controlling fluid buildup. One way to treat is thoracentesis, draining fluid from the pleural space using a needle. Indwelling pleural catheter. A catheter may be placed to allow ongoing fluid drainage. Pleurodesis, a procedure to prevent fluid from reaccumulating by sealing the pleural space. Cancer treatment. If appropriate, chemotherapy, immunotherapy, or targeted therapy might be used to slow cancer progression and reduce fluid buildup. Next, the bile leakage. Bile coming out of the body could indicate complications such as a biliary obstruction, fistula, or damage to the liver or gastrointestinal system. Management may involve a drainage. Biliary drain or stent may already be in place to manage the bile leakage. Surgery, in some cases, surgical intervention may be considered if repair is possible. Medications, supportive medications to manage symptoms, including nausea, bile acid sequestrants, and antibiotics if there's an infection. Symptom management and palliative care. If the focus is on comfort rather than curative treatment, palliative care will aim to manage symptoms like pain, shortness of breath, and nausea, fatigue, and anxiety. Medications and interventions will be adjusted to improve its quality of life. And when it comes to pain management in particular, you got to look at opiates such as morphine, fentanyl, for example, right? Then nutritional support. If bile is leaking and digestion is impaired, your husband may require enteral nutrition, such as feeding via nasogastric or PEG tube, or parenteral nutrition, IV nutrition, if the gastrointestinal system cannot process food, such as TPN. Also, emotional and practical support. A multidisciplinary team, including oncologists, pulmonologists, palliative care specialists, social workers, ICU teams, doctors, nurses, will work with you to plan the next steps. If transitioning to hospice care is something you would consider, they can provide that for you. Questions to ask your husband's doctors: what are the goals of treatment? Extending life, relieving symptoms, or combination? But I go like, you need to ask your husband what he wants. What options are available to manage the pleural effusion and bile leakage? Are there treatments for the cancer that can help reduce these complications? What can we do to prepare for care, potentially at home or end-of-life care if needed, or what curative treatment options are out there? It is an extremely complex and emotional journey. The medical team should guide you through making decisions that prioritizes your husband's comfort, dignity, but also curative chances, if there are any. But also, for example, what about ventilation weaning? Is that a possibility, right? Those are questions you need to ask as well. Is cancer treatment possible? And is then weaning off the ventilator a possibility, getting him out of the induced coma, right? So those are questions you need to consider, right? So also, once the pleural effusion is drained, will that help to wean him off the ventilator? And is a tracheostomy an option? You haven't shared whether your husband already has a tracheostomy potentially, right? There are many unknowns here, and it would be incredibly valuable if you had access to the medical records so we can look at the medical records, right? Now, I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in critical care. And I've been consulting and advocating for families in intensive care since 2013 here at intensivecare.hotline.com. And I can very confidently say that we have saved many lives with our consulting and advocacy here at intensivecare.hotline.com. And you can verify that if you go to intensivecare.hotline.com. If you look at the testimonial section, click on the testimonial section, or if you click on the podcast section where we have done some client interviews who can verify that we have saved their loved ones' lives with our consulting and advocacy. And we can do the same for you here, Tammy, making sure your loved one, your husband, gets best care and treatment always. And that's why we have helped hundreds and hundreds of members and clients over the years to improve their lives instantly and save some of their loved ones' lives. That is what we do. We solve problems for families in intensive care. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And when I talk to you and your families directly, I also talk to doctors and nurses directly with you or on your behalf. And I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that. And we also have a membership for families of critically ill patients in intensive care. And you can become a member if you go to intensivecare.hotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email. And we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I have personally written and recorded. And all of that will help you to make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And all of that you get at intensivecare.hotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecare.hotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell. Comment below what you want to see next, what questions and insights you have from this video. Share this video with your friends and families. I also do a weekly YouTube live, and you will get notification for the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecare.hotline.com email newsletter at intensivecare.hotline.com. Thank you so much for watching. This is Patrick Hutzel from intensivecare.hotline.com, and I will talk to you in a few days. Take care for now.